Welcome, Mr. Newland. Thank you for joining us. Can I start by asking you please to give us your full name, the organisation that you work for, your role within that, and the capacity in which you're giving evidence today?
Good afternoon. My name is Nick Newland. I'm the Policy and Communications Manager for the Associated Country Women of the World. And I'm speaking on behalf of ACWW and our 160 Women's Society members in England, Northern Ireland, Wales and Scotland.
Thank you. Could you first of all please describe the work a little bit, ACWW?
Absolutely. So we are a network, an international umbrella organisation of rural women's organisations. We were founded in 1929. And members include organisations, including and like the Women's Institutes in 82 countries globally. So we work on a dual path of small-scale women-led development project funding and also advocacy nationally and internationally in support of the issues raised by our member societies around the world. Thank you.
And you've provided us with a witness statement, and for the judge's benefit, that statement is at page 3150 of the bundle, and Mr. Newland's evidence is at items 157 to 164. Mr. Newland, can I begin by asking you about concerns that you have seen in terms of the most serious inequalities that rural women experience, specifically with regard to pre-pandemic, and then I will come to asking you about post-pandemic, what you've noticed, what you've seen.
Thank you. I think for us, there are several issues, but one I'd like to highlight right at the start is that by naming rural women as a distinct population, Cedaw moves beyond the implicit focus of urban populations that characterizes a great deal of contemporary lawmaking. And we see that this definition of rural as an informal definition globally, but accepted as communities of under 10,000 people outside of urban areas is really important. Even though it's not generally recognized as a finite definition in the United Kingdom. We feel it's important to note that the inequalities faced by rural women aren't necessarily unique to rural women. However, it is the rurality which exacerbates inequalities. It's the case for multiple and intersecting challenges faced by many marginalized groups, and a stark example is the lack of access to transport in rural areas. According to recent research carried out by one of our member societies, the National Federation of Women's Institutes of England and Wales, published this year, 47% of respondents have experienced reduced access to basic services, transport services over the last 3 years, and 37% have experienced reduced access to health services, all because of reduced transport services in their communities. Now, we recognise that providing local access to all services and intensive medical facilities isn't practical for small rural communities, but in light of this, it is absolutely vital that adequate transport is available to these communities. So bus services, investment in roads and rail networks, safe and accessible for women and girls, and in particular older women and those with disabilities or increased access needs. The lack of adequate transport options isn't the only factor, but it becomes critically important when cuts to local council budgets, which have obviously been vastly reduced since 2010, and the closure of services specifically for women, such as domestic violence shelters, make the isolation of rural areas a political decision far beyond the geographic one. We are very aware, particularly obviously in the last 2 years, but digital access is another issue which exacerbates the inequalities of living in a rural area. Older women in particular need not just access to internet infrastructure, but training in a sensitive and non-patronizing form. The Office of National Statistics publication on exploring the UK's digital divide shows that there is a disparity between men and women digital skills, which is of course no shock to us, but of those having 0 basic digital skills in 2018, 61% were women. Now, we acknowledge that many families have invested time and effort in ensuring that they stay in touch with older and isolated members of their families during the COVID pandemic, but the lack of digital infrastructure and confidence and literacy means that those users are much more likely to be affected by online issues such as malware, viruses, and indeed fraudulent scams. So that generational divide is narrowing, although women continue to lag behind when numbers are compared. And the Citizens Advice Scotland published a study in 2018, which is the most recent figures, showing that 46% of respondents aged between 65 and 79 had never used the internet. Sadly, and this is a consistent theme when we discuss rural women, that data hasn't been disaggregated by gender or geographic location. From what our members tell us, the biggest issues facing older women in rural communities, undoubtedly isolation and loneliness, further complicated and compounded by all the points we've raised thus far. But in addition, there's a lack of access to high quality and affordable care provision. An adjustment of the pension age has only increased the potential for significant financial vulnerability amongst older women. And again, older women in rural communities face these same issues that their urban counterparts do, but with significantly greater challenges in addressing them. With regards to Black and minoritized rural women, there have been limited studies conducted thus far. The University of Birmingham published a study on the experience of rural Black and minority ethnic community groups in June 2015. This drew out some limited points on specific experiences of women related to systematic and consistent experiences of racism in less diverse communities, but sadly this hasn't been addressed as a more of a priority for data collection. We are very aware that it's not so much that specific groups of rural people or women are more or less disadvantaged, but that the widely acknowledged injustices faced by individuals in the form of racism, sexism, ableism, ageism are all exacerbated by living in a rural community. And as rural women are not protected in UK law outside of Cedaw and are not identified as a protected group or characteristic by the Equality Act, nor do they have the necessary protections in the Human Rights Act, we need full and enforceable implementation of Cedaw, and particular Article 14 in the UK.
Thank you. ACWW networks with different societies throughout the UK, and what particular challenges do you see are experienced by rural women in Wales, Northern Ireland and Scotland?
Well, we work hard to gather information from member societies in all 4 nations of the UK, but there is a significant deficit in quality disaggregated data being collected and published, where rurality is considered a factor. And it's very hard to gain large-scale empirical data. We rely on our members and their feedback. The Scottish government has expressed the intention to incorporate Cedaw into law, which we think is a very positive step. And in general, there seems to be a much more positive approach in the devolved governments with a better understanding of a gender lens and the importance of rurality already applied. In Scotland, the Women in Farming and Agriculture Sector research report from 2016 found that the cultural practice of passing on large farms intact to one son, so male succession, is the single greatest barrier to women's entry into agriculture. This means of land transfer is thus institutionalized culturally, though not legally, but there haven't been challenges to this. It's also found that women are very underrepresented amongst the elected leadership of national level farming and agricultural organizations, leading to disenfranchisement amongst would-be farmers and lack of representation for older women in agricultural communities. So the implementation of temporary special measures, as recommended by the Cedaw Committee, like quotas, to address the lower numbers of women in politics, the judiciary, decision-making processes, as well as disabled women and Black and minoritized women and girls, would help redress this balance. And these are points that have been, to extent, accepted by the Welsh and Scottish governments. So the points we've made previously on transport remain the case around the 3 nations beyond England. We conducted our own research as part of a survey of the living conditions of rural women, which showed that only 24.8% have a local police station, which not only reduces confidence in safety, but also reflects reduced access to reporting mechanisms. The absence is obviously much more critical with rising rates of domestic violence due to COVID-19 and the associated lockdown measures. And when we sent preliminary questions by the Cedaw Committee on rural development strategies, access to health, education, employment, transport, participation in decision-making for rural women, the UK chose not to respond. There was no response from the UK government on those issues. And the previous decade of measures which increased poverty rates in rural communities and left women and girls struggling for access to services, they are in theory guaranteed by law, has only been exacerbated by the impact of Brexit on farming communities and of course COVID-19, although we are yet to see the true scale of damage that has been done.
Thank you. Following on from that, and in respect of health and well-being for rural women, what do you see there as particular concerns?
So there is obviously a significant and national, if not national, mental health crisis that is affecting everyone, you could argue, all sectors of community, but particularly in rural and agricultural communities. The suicide rates amongst male farmers are well documented as being above the average, but of course that has an impact on women and families as well. Transport, we've mentioned, police and policing, both in terms of local access and avoiding re-victimization when trying to report gender-based violence. You know, in a small community, if the offender is just as likely to know the police by first name as the survivor, then you have a real issue reporting sensitive crimes. One of the starkest contrasts for us, again, from our own research in the UK, is that whilst 84% of respondents have access to a primary school in their local community, only 36.8% have immediate access to a secondary school for ages 11 to 16. And rural access to post-16 education means leaving communities by necessity, not the situation of choice open to young people in urban centres. And access to education below this level relies on the transport infrastructure, which, whilst government claims to be improving, is woefully inadequate and which has suffered decimation through austerity. Of course, as soon as younger people leave their families because they have to leave rural communities, the family unit is weakened. The impact on unpaid care work, younger siblings, all of these things is exacerbated. In rural communities, limited healthcare facilities and there's distance from the centre of rural communities for major healthcare provision has become even more critical in light of COVID. In fact, yesterday, the BBC published a story highlighting a young woman's day-long efforts to get the COVID-19 vaccination as she had to travel from Monmouth in South Wales to Newport, where only 7 buses a day do that journey. And as she said, it was an hour there by bus, but I also had to arrive 2 hours before my allotted time as the next bus from Monmouth would have made me miss my appointment. You know, it's a 7-hour journey to do a 15-minute jab. Of course, it's just one experience, but it speaks to the norm rather than the exception in these communities.
Which then brings me to my next question. You've already touched on it to some extent, and that is in relation to COVID. So how has the pandemic specifically impacted on rural women?
So I've spoken a little already about the access to technology. You know, we all, indeed today, we all live our lives now on Zoom. And if that isn't a familiar or comfortable space, then it presents real challenges, not just for direct communication, but all facets of life outside of that. In terms of equality outcomes, many of the frontline occupations affected by the virus impact disproportionately on women. We know the statistics on teachers, carers, nurses, and the largely dominant numbers of women in those jobs. But that's not just that they're doing those jobs. It means that the strain that we've all seen increase in the past 18 months affects their families and creates mental health issues and all of the other problems that come with that. Isolation, again, we've mentioned, but this effect is exacerbated for those in rural areas less able to maintain social contact online, whilst also having to social distance and shield. And those impacts are really acute for those already suffering from vulnerability in rural areas, loneliness, social isolation, and then compounded by the lack of access to high-speed broadband, mobile signal coverage, and indeed just being able to cope both skill-wise and physically with technical devices. Again, it seems I'm hammering the point on face-to-face versus digital connections, but for schooling, higher education, business meetings, health consultations, shopping, cultural events. But it's much more problematic when those communities don't have strong internet and mobile connections. Indeed, in the break, I'm not sure of the exact geographic location, but in the break, someone with a colleague with a Northern Irish accent was explaining the difficulties of not being even to join this session. And this is something we've had multiple reports of from our colleagues in Northern Ireland as being a consistent problem for the last several years, not just because of COVID. But access to essential services was already more challenging in rural areas. We already had poorer service capacity and critical mass of key workers, doctors, emergency services, pharmacists. And these vital services are especially vulnerable and at risk of becoming overstretched. The Save the NHS call was an issue in London, but imagine that hospital has 1/10 of the capacity, but five times the number of people proportionally being drawn in it locally. We're also very aware that when those rural services are overstretched and people fall ill or are required to self-isolate, or if there's a rapid increase in cases within local communities, it's linked to an aging demographic of rural communities. Younger people have to leave rural communities to get access to the education and the employment that they deserve and desire, but that weakens those rural communities. Restrictions on non-essential movement have of course impacted rural areas due to the greater dispersal of workplaces, consumer and business services, and the importance of visitor economies. With tourism gone, many of these communities are significantly poorer, and it is inevitably women in those families and communities who are going to suffer the worst. The ability to withstand and adapt to hardship varies greatly, and generalizing too far on impacts from rural communities across the 4 nations is really unhelpful, because whilst government may draw on examples from Hampshire or Surrey, outside of Glasgow, outside of Derry, outside of parts of rural in the Midlands, have a very different experience and live a very different life.
Okay, thank you. I want to go now to asking you 2 more points. The first is in respect of Brexit. I know that you want to say something about the impact that has had on rural women.
Absolutely. We've already seen job losses and insecurity in rural areas as trade deals have either failed to materialize or benefit the agricultural products of other countries. Significant and specific issues surrounding Northern Ireland have, I'm sure, been spoken to by colleagues from organisations such as NIWEP, but the current turmoil is affecting rural communities and their livelihoods now, not in the future. The women, peace and security implications of Brexit, the trade implications, these are not future problems. These are current problems which are already having an impact. The fact that we cannot gather enough data to fully analyse those problems does not mean they are not current. Several current and former government ministers have stated their opposition to various protections afforded to women in UK law, blaming the EU for their imposition. And the rights of part-time women workers and temporary workers are under particular threat of repeal because those leading the campaigns for a leave vote have directly attacked the directives that underpin them. And deregulation of employment rights and a general attitude of deregulation and the reduction of the so-called burdens on business will only ever but worsen the burden on women. And if I can just add in terms of the kind of the cross impact of COVID and Brexit, the studies done by the government after the 2008 sorry, the word has completely escaped. The recession after the 2008 crash, and indeed the impacts of foot and mouth and other big issues seen to affect the rural communities. The government papers suggest that rural communities tend to bounce back in a recession better. But they also strongly acknowledge that that is averaged over the bigger rural areas that surround urban centres versus the smaller ones which tend to get lost. And that's where the data is not being collected. And those studies from DEFRA and other government bodies acknowledge that. So, you know, we cannot draw parallels and say that recession due to Brexit or COVID will be recoverable for rural communities, though it might be something the government can point to.
Okay, thank you. My very last question, and arguably the most important, is what, in your view, will the implementation of Cedaw and specifically its gender-focused approach, how will that help rural women?
Well, Cedaw Article 14, Clause 2.8, the increased participation in decision-making and development of planning in rural areas is critical for the success of Clause 2b, which is having access to adequate healthcare services, including mental health and sexual and reproductive health. It's really quite simple. And this was reiterated by the committee in February 2019, that the voices of, if the voices of rural women were heard by government and genuine action taken to increase participation beyond the flagship internet initiative or some small thing that can be pointed to, that these realities of living would be greatly improved. And it's been shown in programs all over the world for many years that the involvement of rural women in community initiatives lead to improved outcomes. I'm aware of the time, so I would just put a huge signpost to the New Zealand government and its new approach to including not just a gender lens, but a rural lens in all government policy, not just those issues